Imagine waking up yet again to stiff, aching joints that make every step feel like a struggle, a bloated belly that leaves you uncomfortable before the day even begins, or that constant, draining fatigue that turns even the simplest tasks, like brushing your hair or making breakfast, into exhausting challenges. Doctors often call it just aging. But what if that's not the full story? What if I told you that relief doesn't have to be complicated or expensive? What if one of the most powerful healing tools has been sitting quietly in your kitchen cabinet all along, overlooked, forgotten, yet backed by modern science and generations of wisdom? Yes, baking soda. Not just for cleaning or baking, but as a surprisingly powerful remedy, one that your grandmother may have used, and one that modern science is finally catching up with. From arthritis to indigestion, UTIs to skin irritation, it turns out that baking soda may offer simple, safe relief to 13 common health concerns that seniors face every day. And today we're diving deep, not just into folk wisdom, but into the exact biological mechanisms, the scientific studies behind them, and the right way to use baking soda. So you're not guessing, you're healing it with confidence. In this video, you'll discover how baking soda works at the cellular level, balancing pH, supporting kidneys, reducing inflammation, and more. 13 detailed, science-backed benefits of baking soda, explained with research and references. The exact dosage, the timing, and how to use it for each specific condition, customized for your needs. Precautions, side effects, and safety warnings, especially important for those 50 and above. And finally, when to take baking soda, and when not to. This is not just another home remedy video. This is your ultimate guide to natural, science-validated healing, tailored for the senior body and lifestyle. Welcome to PremiumHealthHarbor, your safe space for natural wellness backed by real science. Here we bring together timeless remedies and modern research to help those aged 50 and above not just survive, but thrive. If you believe that healing doesn't always come in a pill, and that the body has wisdom when supported naturally, then you're in the right place. So grab a warm drink, get comfortable, and stay till the end, because what you're about to learn could change how you age. Gently, powerfully, and naturally. Let's begin the countdown to the 13 life-changing health benefits of baking soda, with real studies, clear explanations, and step-by-step usage. We'll start with number 13, and trust me, each one gets more surprising as we go. Number 13, relief from urinary tract infections, so UTIs. Let's begin with something many seniors silently struggle with, urinary tract infections. UTIs aren't just painful, they can be dangerous in seniors, especially when they recur. The urge to urinate frequently, the burning sensation, the lower abdominal pain, they disrupt sleep, limit mobility, and sap the joy from daily life. But here's where baking soda quietly steps in. In seniors, the natural acidity of urine often increases due to dietary habits or weakened kidney function. This acidic environment becomes the perfect breeding ground for bacteria like E. coli, the primary culprit behind most UTIs. Baking soda or sodium bicarbonate is alkaline in nature. When taken in small controlled doses, it helps neutralize the acidic urine, reducing irritation of the bladder lining and creating an unfavorable environment for bacterial growth. Essentially, it shifts the pH of the urine upward, making it harder for bacteria to thrive. A study published in Clinical Nephrology, 2017, highlighted the use of oral sodium bicarbonate in patients with lower urinary tract symptoms, finding that urinary alkalinization reduced the frequency and severity of discomfort, especially in women. Mix 1/2 teaspoon of baking soda in a full glass of filtered water. Drink it once daily, preferably on an empty stomach in the morning, for no more than 3 consecutive days during mild symptoms. Do not use this remedy if you're on a low-sodium diet or have high blood pressure or kidney disease. Always consult a physician if symptoms persist or worsen. Baking soda is supportive, not a replacement for medical treatment when needed. This simple, cost-effective step can offer quick relief and prevention when used with care. Number 12. Natural antacid for acid reflux and heartburn. Next, we move to one of the most common and often mismanaged complaints among seniors, acid reflux. Do you ever feel a burning sensation creeping up your chest after a meal, or a sour taste at the back of your throat when lying down at night? This condition, also known as GERD, gastroesophageal reflux disease, worsens with age due to weakened esophageal muscles and slower digestion. It works as a rapid-acting antacid. Sodium bicarbonate neutralizes excess stomach acid almost instantly, converting it into harmless substances like water and carbon dioxide. The American Journal of Gastroenterology 2010 listed sodium bicarbonate as one of the fastest, short-term acting agents for managing GERD, especially when over-the-counter meds fail to deliver quick relief. Take 1/4 teaspoon of baking soda mixed in a cup of lukewarm water. Sip it slowly about 1 hour after a meal, especially if you feel symptoms coming on. Do not use baking soda as a daily antacid. It can disrupt your natural stomach acid balance if overused. If you're on antacids or proton pump inhibitors, talk to your doctor first. Avoid it if you have gastric ulcers or are on sodium-restricted diets. Think of it as a quick fix, not a daily habit. Up next, number 11. Kidney function support in chronic kidney disease, CKD. Here's where things get serious and surprisingly hopeful. Chronic kidney disease affects millions over the age of 60, yet many don't even know they have it until it's progressed. Symptoms like fatigue, swelling in the legs, or difficulty concentrating are brushed off as normal aging. But recent research has shown that baking soda may slow the progression of this silent condition. CKD often leads to metabolic acidosis, where the body produces too much acid or the kidneys can't remove enough. This can cause bone loss, muscle wasting, and faster kidney decline. As an alkalizing agent, sodium bicarbonate reduces the acid load on the kidneys. This helps preserve kidney function and may prevent long-term complications. In a landmark 2009 study in the Journal of the American Society of Nephrology, researchers found that daily sodium bicarbonate supplementation in CKD patients slowed the rate of kidney function decline by up to 2/3 compared to those who didn't receive it. This treatment must be prescribed. Doctors typically recommend 600 milligrams sodium bicarbonate tablets, not kitchen baking soda, taken once or twice a day with meals. Important caution: never self-treat kidney conditions with baking soda. Improper dosing can cause electrolyte imbalances or even worsen the condition. Always consult your nephrologist or GP before use. Number 10. Improved physical performance and reduced muscle fatigue. Ever feel like your body just can't keep up anymore? Walking upstairs feels like climbing a mountain. Even light exercise leaves you sore for days. This isn't just aging. It's lactic acid buildup in your muscles. During physical activity, your body produces lactic acid as a byproduct of metabolism. When lactic acid accumulates, it causes muscle fatigue, cramps, and soreness, something seniors experience more acutely due to slower recovery and reduced muscle mass. Baking soda acts as a buffer against the lactic acid buildup in your bloodstream. It raises the pH level, reducing acidity, which helps your muscles perform longer and recover faster. A 2013 study published in the Journal of Strength and Conditioning Research showed that sodium bicarbonate supplementation improved endurance and delayed fatigue in older adults during moderate exercise. Take 1/4 teaspoon of baking soda in a glass of water 30 to 60 minutes before mild physical activity, like walking, gardening, or light aerobic exercise. Do not exceed 3 times per week, only for those without hypertension or cardiac conditions, as sodium can raise blood pressure. Avoid it if you're on diuretics or ACE inhibitors. Always hydrate well before and after taking baking soda. This remedy can help you move a little more and hurt a little less. Chapter 9. Natural aid for gout flare-ups. Do you suffer from sudden intense joint pain, especially in your big toe, feet, or knees? That's gout, a type of inflammatory arthritis caused by excess uric acid in the blood. When uric acid builds up, it forms sharp crystals that settle into your joints, causing swelling, redness, and stabbing pain, often at night. Baking soda increases the pH of urine and blood slightly, making it more alkaline. This helps dissolve uric acid crystals and promotes their excretion through urine. According to a 1984 study in Seminars in Arthritis and Rheumatism, urinary alkalinization with sodium bicarbonate was found to increase uric acid solubility, reducing the frequency and severity of gout attacks. Mix 1/2 teaspoon of baking soda in water and drink twice daily, once in the morning and once in the evening, only during active flare-ups for up to 3 days. Avoid long-term use. It can alter electrolyte balance. If you're on allopurinol or other gout medications, consult your doctor before use. Stay hydrated. Aim for 8 to 10 glasses of water per day to help flush out the uric acid. A simple glass of water and baking soda may help break the cycle of painful attacks. Next, number 8. Relief from indigestion and bloating. After eating, do you often feel heavy, gassy, or overly full, even if your meal was small? This is indigestion, a common issue among seniors due to slower digestive enzyme production and decreased stomach acid. By neutralizing excess gastric acid and improving stomach pH, baking soda can aid in breaking down food, reduce gas buildup, and relieve abdominal bloating. A 2007 paper in the International Journal of Molecular Medicine cited sodium bicarbonate as a fast-acting antacid and digestive support agent, improving gastrointestinal comfort when used in moderation. Take 1/4 teaspoon baking soda in a cup of water, 20 minutes after meals that cause discomfort. Do not exceed 2 doses per day. Not recommended if you have low stomach acid, hypochlorhydria, or gastric ulcers. Stop immediately if bloating worsens. Could indicate improper digestion or other issues. This remedy works best after heavy, acidic, or gas-producing meals. Number 7. Oral health and gum disease prevention. Are your gums receding? Do you notice bleeding when you brush or persistent bad breath? These are signs of gum disease, which affects nearly 70% of adults over 65 and is linked to heart disease and diabetes. Bacteria in your mouth thrive in acidic environments and form plaque and tartar. Left unchecked, this leads to gingivitis and eventually periodontitis. Its mild alkalinity helps neutralize oral acidity, while its mild abrasive texture removes plaque without damaging enamel. It also has antibacterial properties that reduce gum inflammation. A 2008 study in the Journal of Clinical Dentistry found that brushing with a baking soda-based toothpaste significantly reduced plaque and gingivitis over 6 weeks. Mix a pinch of baking soda with a few drops of water to make a paste. Gently brush teeth and gums for 2 minutes, once daily. You can also use it as a mouth rinse. 1/2 teaspoon in a cup of water. Avoid brushing with the baking soda more than once daily, as it may wear down enamel if overused. Do not use it on dentures or crowns without dentist approval. It's a powerful tool to keep your smile bright and your gums healthy. Number 6. Balancing body pH and detox support. Have you ever felt tired, inflamed, or generally unwell without a clear reason? Your body's acid-alkaline balance might be off. Seniors especially tend to experience low-grade acidosis, which silently affects energy, immunity, and organ function. As we age, our kidneys become less efficient at removing excess acid. A chronically acidic environment can contribute to inflammation, bone demineralization, and muscle loss. Baking soda is alkalizing. It helps raise blood and cellular pH slightly. This supports a more oxygenated, less inflammatory environment and may aid in cellular detoxification by helping the kidneys flush acids and toxins more efficiently. A 2018 study in the Journal of Immunology revealed that daily consumption of baking soda stimulated anti-inflammatory responses in the spleen and kidneys, potentially lowering chronic inflammation markers in older adults. Add 1/4 teaspoon baking soda to a glass of filtered water and drink it in the morning. Before eating, 2 to 3 times per week. Avoid long-term use unless monitored by a healthcare provider. Don't mix this with acidic detox drinks, like lemon water, as it can neutralize their effect. If you're taking diuretics, corticosteroids, or blood pressure meds, check with your doctor first. Think of this as a gentle internal reset, like spring cleaning your insides. Number 5. Soothing itchy, irritated skin, eczema, rashes, insect bites. Our skin becomes thinner, drier, and more reactive with age. Conditions like eczema, rashes, and bug bites become not only common, but also harder to heal. When skin becomes inflamed, its pH often becomes too acidic, worsening irritation and creating an ideal environment for microbial overgrowth. When used topically, baking soda can help restore pH balance, reduce itching, and calm inflammation. Its mild antiseptic property also help prevent secondary infections from scratching. According to the Journal of Dermatological Treatment in 2003, baking soda baths were effective in reducing itchiness and improving skin barrier function in patients with eczema. Add 1/2 cup of baking soda to a warm, not hot bath and soak for 15 to 20 minutes. For localized issues, make a paste with baking soda and water. Apply to the affected area for 10 minutes, then rinse. Avoid if the skin is broken or bleeding. Do not scrub the paste. This can damage fragile skin. Always moisturize after use to prevent dryness. This remedy offers gentle, chemical-free relief for skin that needs a break. Up next, number 4, natural remedy for cold and flu recovery. Every winter, seniors are urged to take extra care, and for good reason. As immunity weakens, common colds or flu can lead to serious complications like pneumonia. When taken at the early onset of symptoms, baking soda may help neutralize acidity, which viruses thrive in. It may also support immune function by reducing systemic inflammation. It's believed that baking soda increases the alkalinity of bodily fluids, potentially making the internal environment less favorable for viral replication. It also loosens mucus, helping relieve congestion. During the Spanish flu pandemic of 1918, Dr. Edward R. Hayes, in his report to the U.S. Public Health Service, noted that patients treated early with sodium bicarbonate recovered faster and often avoided complications. How to take. Day 1, 1/2 teaspoon baking soda and water, 3 times daily. Day 2, same dosage, 2 times daily. Day 3, 1 time daily. Repeat only during the first 3-4 days of flu symptoms. Do not exceed the above dosing. Avoid if you are already on flu medication without medical advice. Stay hydrated and rest well. This remedy is supportive, not curative. Nature's Pharmacy has been around far longer than the drugstore down the street. Number 3, blood sugar regulation. Have you noticed sudden spikes or crashes in your energy, especially after eating? This might be blood sugar imbalance, a common concern for seniors, even those not officially diagnosed with diabetes. Fluctuating blood sugar contributes to fatigue, brain fog, frequent urination, and long-term risks like nerve damage or vision problems. Emerging research suggests that baking soda influences insulin sensitivity and reduces systemic inflammation associated with insulin resistance. A 2020 study in Cell Reports found that sodium bicarbonate enhanced anti-inflammatory signaling in the spleen and liver, 2 organs critical in blood sugar regulation and metabolic balance. How to use. 1/2 teaspoon of baking soda and water once every 3 days, mid-morning away from meals. Senior warnings, this is not a replacement for diabetes medication. Always monitor your blood sugar closely when adding new supplements. Talk to your endocrinologist or GP before using this remedy consistently. It's a gentle support for your body's natural balancing act. Number 2, bone health and osteoporosis prevention. Here's a surprising fact. A chronically acidic body may leach calcium from your bones, weakening them over time. That's right. Even with enough calcium intake, your bones could be in danger if your pH balance is off. As we age, acid-producing foods and poor kidney function can cause the body to borrow minerals like calcium and magnesium from bones to neutralize acid. By restoring the alkaline reserve in the bloodstream, baking soda reduces the need to leach minerals from the bones, thus preserving their strength. A study published in Osteoporosis International, 2009, showed that alkali therapy, including sodium bicarbonate, slowed bone loss in older adults, especially postmenopausal women. How to take it. 1/4 teaspoon of baking soda in water every other day, best taken midday away from meals. Combined with weight-bearing exercise and vitamin D. Do not use it if you have osteopenia with high blood pressure, as sodium intake must be monitored. This quiet protector might be doing more for your bones than your multivitamin. Number 1, inflammation reduction and longevity support. Finally, we reach what may be baking soda's most powerful benefit of all, its role in reducing chronic inflammation, the hidden culprit behind many age-related diseases, arthritis, Alzheimer's, cancer, heart disease. Low-grade persistent inflammation, inflammaging, accelerates tissue breakdown, weakens immunity, and drains energy over time. A consistent, low-dose intake of baking soda has been shown to activate anti-inflammatory macrophages and suppress autoimmune responses, leading to better immune regulation. In 2018, researchers at the Medical College of Georgia published findings in the Journal of Immunology showing that baking soda shifted immune response from pro-inflammatory to anti-inflammatory, reducing inflammation markers and supporting longer-term health. Take 1/4 teaspoon in a glass of water 2 to 3 mornings per week, especially if inflammation-related issues are present, arthritis, fatigue, metabolic issues. Final senior notes. Pair this with an anti-inflammatory diet for maximum effect. Monitor for bloating or pressure. Adjust dosage accordingly. Never exceed 1/2 teaspoon per day. This tiny white powder could be a quiet guardian against the fires of aging. Now, before you rush to your kitchen cabinet, it's crucial we talk about the other side of baking soda, because even powerful remedies need proper guidance. While baking soda can do wonders, it's not for everyone. Seniors with kidney disease, heart issues, high blood pressure, or those on a sodium-restricted diet should avoid taking it without consulting a doctor. Why? Because sodium bicarbonate can raise sodium levels, leading to water retention, elevated blood pressure, and in some cases, even strain the kidneys further. If you're taking medications like diuretics, steroids, antacids, or blood pressure drugs, it can interact in ways that throw off your body's delicate balance. And overdoing it, that can lead to something called alkalosis, where your body becomes too alkaline, causing symptoms like nausea, cramps, confusion, and muscle twitching due to electrolyte imbalances. So always stick to the recommended doses, usually no more than 1/4 to 1/2 teaspoon per day, and not every day. Think of baking soda as a natural support, not a daily supplement. That brings us to the end of this eye-opening journey into the 13 incredible, science-backed benefits of baking soda for seniors. From soothing arthritis and boosting digestion to supporting heart health and immune strength, this simple white powder has earned its place as one of the most versatile natural remedies out there. But as we've seen, it only works when used wisely, in moderation, and with full awareness of your health status. Now, I'd love to hear from you. Is there a specific issue you'd like me to explore in the next video? Maybe something that's been bothering you or someone you love? Which of these benefits surprised you the most? Have you ever tried baking soda for your health? What happened? Whether it worked wonders or didn't go as expected, your experience could help someone else watching right now. So please, take a moment and share your story in the comments below. Your voice matters, and together we can build a community of real knowledge, real healing, and real results. If you found this video valuable, don't forget to like, share, and subscribe to Premium Health Harbor, where natural wisdom meets science-backed healing, especially for those aged 50 and beyond. Until next time, stay well, stay curious, and always listen to your body. Thanks for watching.